Hi, I'm Maria. I'm going to be your student nurse today. I'm going to close this curtain for privacy. I'm going to wash my hands. And I will be wearing gloves, but not right now at this moment. And we're using non-sterile gloves. Just need you to verify your name and date of birth. Joe Smith, 1953. Okay, perfect. Check that on your bracelet. Matches with my doctor's orders. We have a doctor's order here to go ahead and change your tubing for your intravenous therapy. Do you have any allergies? No? Okay, perfect. Okay, so what I'm going to do first is check for, make sure we don't have any phlebitis. I don't see any redness. Is there any pain or anything like that? Just no swelling. So we're good there. And then, excuse me. Also going to check the expiration or when it was put on. It's been within the 96 hours. So I am able to go ahead and change the tubing. So I'm just going to make sure I have everything that I need here. Okay. And I have my 1,000 milliliters of sodium chloride, 0.9% sodium chloride. The packaging is intact. I don't see any crystallization. And the package is good, and it is not expired. And then I have my sodium chloride 0.9% injection fluid, and the package is intact, and integrity is good. So I'm good there. I'm just going to compare this to the MAR. So I have my 1,000 milliliters, 0.9% sodium chloride, and it's not expired, and 0.9% sodium chloride injection, and that also is not expired. So I'm done with my first check. And as far as my math goes, I already have that done. We're doing 100 millimeters an hour. We're doing 16 drops a minute. So we got that figured out. And then I'm going to do my second check. So I have my 1,000 milliliters here, 0.9% sodium chloride. It's not expired, and the integrity is good, no crystallization. And I also have my 0.9% sodium chloride injection, comparing that to the MAR as well. Integrity is good, and it's not expired. And I'm just going to go over my 5 rights. I have the right patient, right medication, right dose, right route, right time. And then I'm going to do my third check. And I have my 1,000 milliliters, 0.9% sodium chloride. And I have my 0.9% sodium chloride injection. And that's on my MAR. And the packaging is good for both of these. So I got my 3 checks done for my intravenous solutions and medications. Okay, so I'm just going to set these right here. Okay, and then I'm just going to check, open up my tubing here and make sure the package is good, the integrity is good, so no issues there. I'm going to open up my tubing. Okay, and make sure that my clamp is closed here on my tubing. And set that right here. I'm going to open up my bag. Alright, so I got laying flat on the table. Okay, I already clamped my tubing. So I'm just going to take this cap off. Take this cap off. And go thumb to thumb. And push and turn. Okay, and I got that connected, so I'm going to hang my solution here. Okay. Alright, and so now I'm just going to grab my ports here and make sure that these are all down. And I want to make sure that I have this halfway filled, so I'm going to do 3 squeezes. So 1, 2, 3. But I'm still not halfway, so I want to make sure I go halfway. Then it's halfway full. Alright, so I have my ports facing down. And now I'm going to slowly release so I can make sure that I don't get any air in the tubing. And I'm just going to watch the line. Go all the way down. Just waiting for all my bubbles to go out. Okay, now all my bubbles are out, so I'm going to close the line here. And place this on the side. Alright, so I'm going to wash my hands again and put my gloves on. Alright, so I'm just going to put my gloves on here. So I'm done priming my tube. And there's no bubbles. So again, I'm just going to open this up and have it ready for me. The packaging was good. Look at there. And I'm going to wipe down for 30 seconds vigorously on the port. Alright, it's been 30 seconds. I'm just going to place my alcohol swab right there so I can keep my sterile area. Make sure there's no air in here, so I'm just going to put some pressure on there before I pop open. Alright. And I did not break sterility or anything. So now I'm going to thumb and push and twist. Alright, now I'm going to aspirate. I want to make sure that I see some of the pink in the J tube, and I do. So now I'm going to do the push-pause method. I'm pushing in the fluid. Okay, and I don't see any signs of infiltration. There's no pain or tenderness, and it's cool. So it's not cool to touch, so you're good to go there. Now I'm just going to leave this here so I can keep my sterility. And I'm going to open up my cap here. And I'm not touching the tip. And I'm going to twist. And just drop that. I'm going thumb to thumb. And push and twist. Alright, so I am connected. So now I'm going to tape this on here. Okay, where'd my tape go? Alright. Because I don't want to risk it being pulled out. Okay. And now I'm going to make sure that I have my 16 drops per minute. So 4 every 15 seconds. So I'm going to release the clamp here. 1. Alright, so I have my 16 drops per minute. Now I'm just going to put my initials and the date and time on this. My pen, and I'm going to tape it on the tubing so that people are aware of when it was changed. Alright, so that completes our task. Is there anything else I can do for you? I clean up my mess and document, and we'll be good to go.